Hi, my name is Alexandra Luzier, and I am the Senior Director of Business Development and Communications with Accessible Pharmacy Services for the Blind. Before we get started, I just want to give a huge thank you for everybody for coming and participating. This is our first year doing the Blind Health Expo, and we were absolutely overwhelmed with the positive response that we've gotten, and just the sheer number of people who have participated and signed up to be an exhibitor or just attend. And we're just so thankful for everybody for coming and just giving all of your thoughts, and it's just been wonderful. So thank you. We have already have a date on the calendars for next year and the next Blind Health Expo, so please get your calendars out and mark that date. The next annual Blind Health Expo is on Friday, December 1st, 2023. We hope to make it bigger and longer and better. So please, after this Blind Health Expo is over, please don't hesitate to give us feedback. We welcome all of your opinions, and we want your feedback on this Blind Health Expo to make the next one bigger and better. We will also be releasing our webinar schedule for next year. These webinars will all be certified so that you can earn continuing education credit for attending them. Please also, when you give us feedback about the Blind Health Expo, give us some ideas on different webinars that you would like to hear about, topics, speakers, different presentations that you would like to learn about. Please just let us hear it, and we would love to hear your feedback on that as well. Without further ado, I would love to start our continuing education segment. As I mentioned before, this segment is certified by the ACVREP and the CRCC for 1 continuing education credit. And I also just want to give a huge thank you to all of the providers who are attending this segment. A lot of you guys are the individuals who are referring patients to us. So we couldn't do what we do without, you guys doing what you do. So we're so thankful for your collaboration in this space and in this community. So thank you. Without further ado, let's get started. So the speaker that we have today is Abby Chesterton with Penn Medicine from the University of Pennsylvania Hospital System. She is with the Diabetes Education Center. She is the director of the Diabetes Education Center, and she is an absolute rock star. We're so grateful to be able to work with her. She is an absolute champion in the diabetes education space, and we're just so thankful for her. She will be doing a comparison on different continuous glucose monitoring systems. So without further ado.
All right, perfect. All right, everybody. So I'm just going to get ourselves set up here. All right, Alex, can you see the slides? Okay, perfect. Yes. All right, so like Alex said, my name is Abby Chesterton. I am a registered dietitian by training and a certified diabetes care and education specialist. I've been working with the diabetes population specifically for about 7 years now. So I was really excited to approach this topic. I learned quite a bit through the process. So that was really exciting for me as well. So I'm really hopeful that, if you guys have questions afterwards, please feel free to send them over to Accessible Pharmacy. I am more than happy to delve in, learn a little bit more, see what I can find out, and get back to you if I don't know the question's answer off the top of my head. So like Alex was saying, today's topic is going to be continuous glucose monitor use, or the abbreviation that we'll use is CGM. And we're going to be talking about the accessibility features of these monitors for the blind and low vision community. So continuous glucose monitor, or CGM technology, helps to monitor someone's blood sugar levels without having to poke a finger and get a blood sample. So a CGM is a device that automatically tracks blood sugar levels for someone without, again, having to poke their finger for a blood sample. This makes this piece of technology a huge help for the blind and low vision community, who we all know has a lot of difficulty with setting up a needle and a lancing device, getting that blood drop onto a test strip in just the right place. CGM technology really works with a tiny fiber that's inserted under the skin. Each CGM that's out there does utilize an insertion device. So someone is not going to see a needle that's inserting this fiber. It all happens really with the click of a button. And so it's very easy to utilize these technologies. The fiber itself that stays under the skin is going to measure the sugar level in the fluid in between our cells. So this is called interstitial fluid from a medical perspective. These CGMs are going to measure blood sugar levels about every few minutes. We'll talk more specifically about each one independently. The sugar level on a CGM may vary slightly from the sugar level that we would get if we were to poke a finger to check a blood sugar level. This is simply just a reflection of the different type of fluid that we're measuring. And we do expect some difference. If we're seeing large differences, if someone is doing a verification finger poke, we would want to troubleshoot that with you to make sure that we are successfully getting accurate readings from your glucose sensor. CGMs use a transmitter wirelessly send blood sugar information to a receiver device. So whether the transmitter is attached to a sensor site or whether it's kind of an all-in-one sensor site, including the transmitter, that's how the information is sent from your body to your receiver device. CGMs can send information to smartphones, tablets, or we will touch on the devices that come with them from the manufacturer, but we'll touch a bit on why the device from the manufacturer isn't going to be the best for this population. Great news is these technologies can be worn during bathing, showering, swimming. The Libre itself doesn't recommend being submerged for longer than 30 minutes or in water deeper than 3 feet. And the Dexcom doesn't actually has a much longer waterproof qualification, I guess. The Dexcom says when properly placed, it can actually be under 8 feet of water for up to 24 hours. Now, I don't know of any person who will be under 8 feet of water for 24 hours, but the device would still work in that situation. All right, CGMs are going to be able to provide 24 hours a day of blood sugar information. So they are going to tell us what our blood sugar currently is, and it's going to be able to tell us trends in terms of where we're going and where our blood sugar has been. CGMs have special features, including alarms that will tell us when the blood sugar is too high or too low. It also can tell us or can provide us the opportunity to track things as well. So not necessarily a feature that's going to be used too much with visually impaired clients, but if someone wanted to, they would be able to track and log their meals, their exercise, their medications. CGMs also allow for sharing of information or following. So loved ones or diabetes care teams, whether it be your diabetes educator or your doctor, can actually follow your information along. This has been a huge help with telemedicine being so big since the pandemic. And we are able to just log into our computer and see someone's blood sugars who may be, 20 miles or more away. In theory, if I had a client in California, I would be able to still see their blood sugar numbers, even though I'm here in Pennsylvania. Now, some CGMs do require calibration in which a blood sugar from the finger would be taken to verify against the sensor reading. And so I'll touch on that when we get to it. And I'll kind of explain why those sensors aren't going to be as accessible for visually impaired individuals. So the first sensor that we'll spend some time talking about today is going to be the Dexcom G6. For those of you who are visually impaired, the image that I have here on the screen is just the different pieces that come as part of this system. So we have a picture of a phone that displays the blood sugar information, or we also have a picture of the receiver from the manufacturer that would display blood sugar information. We also see the sensor applicator and the transmitter and sensor site that actually provides the blood sugar information. The Dexcom G6, we're going to start off just by talking a little bit about how it works. So this sensor is worn for 10 days. So we'll put it on and it will provide blood sugar information for a 10-day period. This sensor system has a transmitter that is separate from the sensor site that when we begin a sensor session, we put onto that sensor site itself. That transmitter we're going to use for a 90-day period or a 3-month period. So this part can be a little bit tricky for people who are new to the Dexcom because when we're changing the sensor site, we're not always changing that transmitter. So it's something during a training that we really drive home to the individual to make sure that they understand which piece am I getting rid of and which piece am I keeping. Dexcom G6 is approved by the FDA for use on the abdomen. In practice, technically off-label, I can tell you that individuals wear this sensor in other locations on their body as well. So individuals may wear this on the back of their arm. They may wear it on like their backside or kind of that like love handle hip area, or even on the outer part of the thigh. Dexcom results can go to, like we said, either their receiver or a smartphone or tablet. The receiver that comes from Dexcom is not accessible to the low vision or blind. So in this case, we are talking about using an external to the company device. The Dexcom will provide a new blood sugar reading as frequently as every 5 minutes. And again, it will trend those numbers for you. Dexcom can have alarms for a low blood sugar, high blood sugar, if you get a loss of signal between the sensor and your reading device. It can actually predict low blood sugars for you or high blood sugars and will alert at you up to 20 minutes before that blood sugar happens, which is great because that can help you to treat a situation differently because you have more information. There are also customizable alert levels, as there are with all of the sensors that are on the market. Best thing about the Dexcom G6 is that there are no finger stick blood sugar readings required. So you do not have to poke your finger with this sensor. It is approved to tell you your blood sugar all on its own. When it comes to the initial setup of Dexcom, and this is going to be the same for Libre or any of the other sensors that might be on the market, creating an account, logging into the app, setting up your alarm settings may be more difficult for the visually impaired. It's not going to be impossible, but for example, the Dexcom G6 app, the customizable alerts and target blood sugar menus are scroll to select menus. And depending on what features you're used to using on your phone, it may be more difficult for a visual impairment. I did play with it with the voiceover feature, and I was able to select and change those blood sugar levels. So it would just take a little bit of patience, I would think. Dexcom is a little bit different than Freestyle in that there are 2 apps that someone would use with Dexcom. So the Dexcom G6 app is going to be the one that's on the device that is going to tell you your blood sugar levels. The Dexcom Clarity app is going to be on your device, and that allows you to share your information with your care team. In the Clarity app, again, in the setup phase, might be a little bit more challenging. There's going to be navigating certain menus to generate a share code. So for example, you would go into the app, you would go to your profile, you're going to click authorize sharing, click generate code, click for how long you want to generate that code, and then there's going to be a 16-letter code that you would give to your provider. All possible steps, again, just might take some patience for someone with a visual impairment. My biggest recommendation would be if you're going to start on this sensor, same thing with the Libre. If you're able to get some assistance from maybe your diabetes educator or a care manager or a nurse in your prescriber's office that might make that setup just a little bit faster for you, and it might make you feel a little bit more comfortable getting started. One of the things about the Dexcom G6 that I think poses a bit of a, let's say, speed bump for someone with a visual impairment would be the fact that we need to enter a sensor code and a transmitter code into the app when we're getting started. Now, the good news is this code can be entered through a picture on the phone. Basically, it's going to scan a QR code to get that information pulled into your system. Fortunately, the photo does not have to be high quality. So as long as you're able to get that code somewhere in the visual area of your camera, it should be able to capture that and get your sensor and your transmitter logged in. Again, if you're getting assistance the first time setting this up, this would be something that someone could help you maybe place your hands in the right kind of positioning so that you're able to feel what's the distance, what's the kind of the proximity that I need to have my phone in these compared to these scans. Now, I was thinking about it with my coworkers just yesterday. How are we going to get the transmitter code scanned in? Because it's on a box and it's hard to tell when you're feeling a box what the different sides are going to have. And so I figured it out for you guys. So if we're looking at the Dexcom the transmitter box, there's going to be a tab that opens the box. When that tab is open, your sensor code is going to be on the side of the box that's connected to that tab. And the sensor code is going to be in the upper left-hand corner. For someone to know the placement and know exactly what side of the box to find it, it's going to make it a lot easier for you to scan that code into the system. Now remember, the transmitter code only going to be entered within once in 3 months. So you're not going to have to worry about that one as frequently. And that one was a little bit harder to take that picture of. The transmitter, once in 3 months, the sensor itself every 10 days. But it's easier to find the sensor code. It's going to be on the applicator. And that applicator is going to fit in your hand. There's going to be a flat side of the applicator. And that flat side is where that sensor code lives. So it's a lot easier to take a picture of the sensor code. Now, the next few slides I have in here for both the Dexcom and the Libre, really step-by-step directions on how to go through, how to insert the sensor, add the transmitter, get the app started. I don't want to spend a ton of time on these slides at this point because I don't want to short the information at the end of the PowerPoint. Assuming we have time, absolutely, I'll plan to come back and go through step by step how to do each sensor insertion. I'll just kind of talk through the basics here. When we're talking about the Dexcom G6, the first step is going to be to get the sensor site onto your body. So we're going to use the applicator. It has an insertion button. It's one click and the sensor site goes onto your body. The next step with the Dexcom is going to be to add a transmitter to that sensor site. The transmitter has one side that's very smooth and flat, has one side that's actually kind of 2 levels. That's going to be how we can feel around to feel where that's going to go into the sensor site on your abdomen. Once the transmitter is into that sensor site, we're going to go ahead and we're going to be able to start the sensor session. And by doing so, we're going to be able to start seeing our blood sugar readings. Once everything is on your body, we're going to go back into our app. It's very easy to get into the app, really, from an accessibility feature. You can simply just say, hey Siri, or whomever your phone's manager would be, and you're going to be able to say, open Dexcom G6. Makes it super simple for you. The transmitter should pair automatically with your phone. Usually there's a pop-up notification with an audible alert as well that says Bluetooth pairing request, and you can click the accept or the pair button actually on the bottom right portion of that notification. Right in the middle of the screen, there's a start sensor button. You'll click that and that'll initiate the 2-hour warm-up period that we have for the Dexcom G6. When it's in that warm-up period, you will not receive blood sugar numbers. So in that 2 hours, if you were to have a need to check your blood sugar, unfortunately, we would be talking about a finger poke blood sugar if you were able to do that. Once your sensor session is started, you need to stay within 20 feet of your body where the transmitter is and your receiving device. If you go too far, like let's say your phone is upstairs in your bedroom and you have to run to take the trash out or something, once you come back together, they will resume, but you wouldn't get any information in terms of alerts or blood sugar information while you were too far away. After the 10 days is up and our sensor session has ended, the app will notify you that your sensor has ended. It actually, Dexcom gives you quite a few reminders. It tells you at 24 hours that you have 24 hours left and reminds you again at 8 hours, 2 hours, and 30 minutes. And those are pop-up alarm, kind of pop-up notifications on your phone. So if you're using, for example, speak screen or voiceover, you'd be able to read, quote unquote, those alarms. You'll pull the entire sensor site off of your body just like you would if you were removing a bandage. So you'll loosen, if it hasn't already, loosened part of the adhesive on your body, get your fingernail under there and just pull it off just like a Band-Aid. Now remember, we've said that the transmitter for Dexcom is used for 3 months. So you're able to kind of put the hand on either side of that sensor site and bend your hands down towards the floor. This actually breaks the sensor holder, and that allows you to slide the transmitter out of that sensor holder so you can use it again for your next sensor. So again, that means you're only entering the transmitter photo once every 3 months. It's the sensor code photo that you'll be doing every 10 days. Next, we're going to spend some time talking about the Freestyle Libre 2. So Freestyle Libre, you may have seen the 14-day sensor as well. That was their original one. We are now in the United States on Freestyle Libre 2. Freestyle Libre 3 has been approved, I believe, in Europe. So hopefully it'll be coming here soon. On this slide here, I do have a picture of the Freestyle Libre system. A few less devices here. So in this picture, we have a photo of a screen of a phone that has the blood sugar information on it. We have a picture of the receiver from the company that has the blood sugar information and a picture of the sensor itself, the sensor site, I should say, itself. A little bit different. The Freestyle Libre is approved for a 14-day wear. So we've got 2 full weeks here from this one. And it is an all-in-one device. So that does make it a little bit easier for sensor insertion, being that once it's inserted, we're only inserting one piece. Freestyle Libre is approved for use on the back of the arm. And unlike the Dexcom that people wear in other locations of their body, typically I really only see Libre being used on the arm. Big difference here between Dexcom and Libre is that Libre requires interaction with your device and the sensor in order to receive blood sugar information. So unlike the Dexcom, which automatically pushes information from your sensor to your phone, Libre requires you to interact with your phone and then interact with the sensor in order to see blood sugar information. Now, the receiver that comes from the company, again, is not an accessible device. So we are going to, again, want to use a phone, a tablet, something along those sorts. The Libre also will provide your current blood sugar information as well as trends regarding where you're going and where you've been. Interestingly, the Libre, in my experience here, the directional arrows or the trends in your blood sugar aren't as accessible from a voiceover or speak screen perspective as the directional information is from Dexcom. But we'll get to that in another couple of minutes. Just like the Dexcom, Libre does provide alarms for low or high blood sugar, loss of signal between the sensor and the reading device as well. Now, interestingly, the Libre may recommend that someone complete a finger stick blood sugar. It is not required, meaning if you don't check your blood sugar by a finger stick, it's not going to stop giving you blood sugar information. But it may recommend that we do a finger stick. Typically, it will recommend that more frequently in like the first 12 hours that you're wearing the sensor. And I found out through practice here that the notification that it's recommending a finger stick doesn't come through on accessibility features. So using voiceover, speak screen, or text to speech, it's not going to tell you that it's recommending a blood sugar reading. It is simply an image on the screen. For us sighted individuals, we would see a small magnifying glass with a small blood drop next to it, and that's them indicating, hey, might be worth checking your blood sugar with a finger stick. The sensor might not know you enough yet. But unfortunately, from an accessibility feature, that's not going to come through. So again, you don't have to provide a finger stick blood sugar to this sensor for it to continue to work. It's just something that is there that accessibility-wise may not translate. As I said, with the Dexcom, logging in, setting up an account in the Libre 2 app may be slightly more difficult for someone with a visual impairment. Again, it does have those customizable alerts and target blood sugars that are the scroll to select menus. So it is possible, it just might take a little bit of patience to get that set up. If you have the ability to set that account and that app up with a sighted individual, it might make your life a little bit smoother transitioning to the sensor. The good news is from the Libre 2 perspective, once your app is set up, there's no updating. So unlike with the Dexcom, where you have to update your sensor code every 10 days, once you're up and running with the Libre 2 app, it's a little more straightforward to transition from one sensor to another. Again, the next couple of slides that I had written out, I'm more than happy to come back to if we have time, walks through the different steps in inserting a Libre sensor. We have two pieces here for the Libre sensor as well. We have a sensor pack that is kind of a round package. Honestly, it reminds me of a K-cup. So for those of you who can feel and visualize in your mind a K-cup, that's kind of what we're looking at when we're looking at the sensor pack. Round on the bottom, a little tab for the lid on top. We also have the sensor applicator, which is going to look slightly different than the Dexcom does. It has a cover on the bottom that one would twist off in order to expose the applicator itself. We then have to line up the applicator over the sensor pack just right in order to get that sensor loaded into the applicator. So Dexcom had the benefit that the sensor site was already loaded in the applicator. With Freestyle, we have to load it in. Now they make it pretty foolproof. The applicator and the sensor pack only fit together in a very specific way. So as long as we're able to line up those two spots, it's pretty straightforward in terms of loading them together. If you put the two pieces together and they aren't connecting, you can just rotate that sensor applicator on the top of the sensor pack until the two click together. Once we have the sensor loaded into the applicator, we take that applicator. It has kind of like a hollow tube almost on the bottom part of it that the sensor pack locates into and loads together. And we take that hollow tube, our hand is on the top of the applicator, which is hard, solid plastic. We put that tube on the back of the arm and we'll push that solid plastic part into the arm, which actually does the insertion of the sensor for us. We'll hear a click when that push happens, and that click indicates that the sensor is going into your arm. We then remove the applicator and that sensor is inserted for us. Again, final steps. we'd be going back to our application to go ahead and start the sensor. So you can ask your phone's assistant to help get you there. Now, in the Libre 2 app, I found that the voiceover feature tended to be more straightforward than the speak screen. So while we're starting the sensor, middle of the screen, we're going to locate the scan sensor button. Once we've clicked that, it'll let us go ahead and scan that sensor. Now, to scan the sensor, I think I mentioned already, but we're going to take the top of the back of our phone, usually where the camera is, and we're going to take that area of the phone and we're going to hold it just over the sensor. Doesn't have to touch the sensor, and it actually can read right through your clothing. Once you're holding it over there, your phone will vibrate, and that'll indicate that it has actually done the reading for you. Next, then, on the screen, you'll see that you have a sensor countdown, basically. So it'll say sensor ready at, and then whatever time. This Libre has a 1 hour warm-up time, so slightly less of a warm-up than our Dexcom does. On the screen, it'll also indicate how many minutes are left remaining before that sensor is going to be fully functional. Just like the Dexcom sensor, we will not get information in terms of what our blood sugar is during that 1 hour warm-up time. The speak screen reads out the entire kind of hidden menu on this sensor ready at whatever time screen before it tells you how much time you have until your sensor is active. So for example, on my screen, it says, Freestyle Libre, it says Abigail Chesterton, it says logbook. It goes through all of a menu that you don't even see on the screen before it then tells you what is on your screen. So it's not going to not work. It's just going to take you maybe an extra minute to hear what time your sensor will be ready and how much time remains until then. Now, Libre recommends staying within 33 feet of the sensor in order to get those alarms and alerts. To scan the sensor, as I mentioned, we do need to interact with the app on the phone and the sensor in order to get the information. So every time you want to see your blood sugar, you have to open the app. Again, your phone assistant can help. You'll then find the check glucose button on the screen, which tends to live at the bottom of the screen. You'll check that button that says check glucose. It'll show a ready to scan screen on your phone, and then you'll complete that you'll complete that scan again with your phone touching next to the sensor itself. If we have voiceover on, that ready to scan screen will read out for you. So you'll know exactly when to go ahead and complete the scan to check your blood sugar. Once the sensor has scanned, you'll feel a vibrate on your phone, which is going to indicate that the sensor has been read. A scan complete window will show and then will go away. Again, if you have the voiceover feature on your phone, it will read out that scan complete, and then you're able to have it read out your blood sugar as well. The blood sugar reading will display at the top middle portion of your screen. So you could hold your finger over that area in order to read out your number. With the Freestyle Libre, the way their algorithm is programmed from a computer perspective, the directional arrow of where your blood sugar is going will not read out. So whether you are using voiceover, whether you are using speak screen, it will only tell you what your blood sugar is. It will not tell you where you're going. Both the Dexcom and the Freestyle also cannot read out your trend graph from where you have been. So Dexcom will tell you where you're going. Freestyle, unfortunately, the readout at this point does not. If your phone is unable to scan your Libre sensor for any reason, it will vibrate and then display an error message that can be read out again with voiceover, not with speak screen. The error will say scan error, your scan was unsuccessful. Tap the scan button and scan again. you can click OK to clear the error and then find the check glucose button at the bottom of the screen and try again. I honestly don't know why sometimes it doesn't scan correctly. It happens to me, and I don't exactly understand what the rhyme or reason is. I just don't know if it's a phone timeout or what it may be. So just because you get a scan error doesn't mean there is something wrong with your sensor. Just clear the error by clicking OK, find the check glucose button again at the bottom of the screen, and scan again. At the end of the 14-day period, again, the app will notify you that the sensor session has ended. You'll pull the entire site off of your body just like you would if you were removing a Band-Aid, and you'll dispose of the sensor in accordance to your local guidance for disposing of materials exposed to body fluids. You don't have to keep any part of the Libre 2 sensor. The whole thing just goes right in the trash. And if you were going to place another sensor, you would follow the same insertion steps. You would put it in, you would click to scan new sensor, and it's going to start a new sensor session for you. Very briefly, I'm going to touch on the Medtronic Guardian Connect sensor. It's not one that most people are familiar with. It is one that more commonly goes with an insulin pump, less commonly is a standalone glucose sensor. Again, the image that's on this screen is a picture of the phone that is displaying the blood sugar number, a picture of the sensor site itself. The sensor is a small, kind of half moon shaped white transmitter, a sensor insertion site, applicator, and then a charger for the transmitter itself. So I would say if I had to say system like pieces wise, I would say the Medtronic has more similar number of pieces as the Dexcom. The Freestyle is slightly more simplified. Now, the Medtronic Guardian Connect is only worn for 7 days. So we're talking about a once a week transition here. It is fully approved for use on the stomach, the backside, or the back of the arm. So it is fully approved for more wearable areas. It connects to a smartphone app, the Guardian Connect smartphone app, to receive your readings. It tells you a new blood sugar level every 5 minutes, so similar to the Dexcom. And it, again, also provides both high blood sugar alerts, low blood sugar alerts, loss of signal, going to tell you your current blood sugar, and it also does have directional information available. The Medtronic Guardian Connect can provide predictive alarms up to 60 minutes before a high or a low blood sugar. So it can give you a little bit more forewarning that something is changing, but the difficult insertion and the difficult starting of a sensor, in my opinion, really significantly limits its use in a visually impaired patient. And biggest thing is that the Medtronic requires at least twice daily finger stick calibration blood sugars. So twice a day, at least, it will alert at the user to poke your finger and check your blood sugar, enter that blood sugar into the system so that it can verify the sensor. So in my opinion, that makes it completely not applicable to someone who has a visual impairment, because we have to use a regular traditional glucometer if we're using this sensor. So that's all we're going to say about that one. There are a few things I just want to review here that are going to talk about making CGMs accessible, and then we're going to touch briefly on eligibility and coverage. So Alexa works with Dexcom G6 through a SugarMate skill. So enabling the SugarMate skill on your Alexa device, and I apologize if through this we are getting your Alexas all riled up. But we're going to enable that SugarMate skill on your Amazon device, and you'll be able to hear glucose readings from your CGM. You don't need to be a SugarMate user through the app on your smartphone in order to enable the skill on your Amazon device. You would basically say, Alexa, ask SugarMate for my latest reading, and she'll read out. An example would be, it's 153 and rising, last checked about 5 minutes ago. It's 5 higher than your previous reading. So the sugar mate scale really gives you a lot of information. And it, again, will also tell you where you're going, which is great. Siri and Dexcom are also very user-friendly together. Some features of the Siri with Dexcom are a little more straightforward for older iPhones, although I was able to make it accessible on I think I have an iPhone 13. So within the Dexcom app, you are able to set up Siri shortcuts and customize a phrase. So in the Dexcom app, you are able to say, hey Siri, what's my blood sugar? And then anytime you want to know, you can ask Siri. So for example, let's see if mine will work. Hey Siri, what's my blood sugar?
Okay, viewing. You're 107 and steady.
So my Siri tells me my blood sugar is 107 and steady. And that's exactly how the Siri would work. You don't have to open your phone. You don't have to open the app. Now, with Dexcom, if you're relying on alerts that will tell you if you're going high or low, Siri won't read those out on her own. You would have to be alerted and then ask what your sugar level is. You can.
I'm sure I understand.
She's still trying to talk to me. Sorry about that. You can also ask her to open the Dexcom G6 app, and then from there you can use speak screen or voiceover to read out the blood sugar and the direction. Now, I found very user-friendly the voiceover feature or the talkback feature on the smartphone to work very well with both of these devices. It'll allow you to hear your current blood sugar reading within any of the CGM apps. The voiceover will read the blood sugar result when it is selected on the screen. As I mentioned in Libre, it doesn't read out the direction, but in Dexcom it does and would indicate whether you were steady, rising, or falling. Speak screen works really well as well. I felt like it was a little more user-friendly within the Dexcom app compared to the Freestyle Libre app, but it allows you to hear the information that's displayed on the app screen, including for the warm-up time, that you're in the warm-up phase and how long until your sensor is active. Again, speak screen for the Libre is not going to indicate which direction your blood sugar is going. Speak selection, I really didn't find super user-friendly with the CGMs. In theory, the speak selection would allow your user to hear the information selected on the screen within an app. Really, the blood sugar information within these apps isn't really set up to be quote unquote like selected, which meant that it was more difficult to select it to have the phone read it out. So that could be more difficult from a visual impairment perspective. So in my experience here, the voiceover or talkback feature or the speak screen feature were much more accessible for these CGMs. Now, the text to speech function on some phones ran into an issue with the Freestyle Libre recently. We actually got a message from Libre telling us that Apple devices that have been upgraded to iOS 16 may run into problems with the text to speech feature. So they were really recommending don't update if that's the feature that you rely on for reading out your Libre. They found during pre-release testing of the new operating system that the text to speech feature was acting incorrectly. If you've already upgraded and you can't go back, like we said, fixes for the interim would be the voiceover or the speak screen. Last couple slides here, like I said, are going to be on the cost and eligibility for CGM. So commercial insurance coverage varies, but typically commercial insurance is, I would say, more likely to cover a CGM with flexibility. And that'll make sense here in just a second. So Medicare is pretty strict with coverage for CGM. So to qualify under a Medicare plan, you have to have either type 1 or type 2 diabetes. You must use an insulin pump or take 3 or more insulin injections per day. And your provider has to document that your insulin treatment requires frequent adjustment based on your blood sugar readings. They also have some guidelines in terms of how frequently you are seeing your provider. And I'm not sure if these two requirements adjusted at all for the pandemic, but I'm going to read them as stated currently on the website. So within 6 months prior to ordering the CGM, an individual had to have an in-person visit with your treating practitioner to evaluate your diabetes control and determine that you meet the criteria. From then, every 6 months after the initial prescription of the CGM, the individual has an in-person visit with the treating practitioner to assess adherence to the CGM and your diabetes plan. So basically, they're saying it, at least prior to the pandemic, that you needed to have an in-person visit with your provider at least every 6 months in order to continue CGM use. Now, for those of you out there with diabetes, typically you're probably seeing your provider in person and or virtually at least every 3 to 6 months. So these two requirements aren't the hard ones to qualify under. I would love if Medicare would cover for more conditions than individuals who are taking 3 or more insulin injections per day. From a diabetes educator perspective, we know that there are plenty of other medications that are regularly prescribed for diabetes that would be equally as beneficial using a CGM. Also, CGM is going to provide us more usable information than just a finger stick blood sugar does. So I cannot wait until CGMs are the norm and finger stick blood sugars are less common. So I'm going to do everything I can to try to make that happen because CGMs I believe in so much. With Medicaid plans, unfortunately, some states will only cover CGM for Medicaid patients who have type 1 diabetes. So even if a Medicaid patient has type 2 and takes 3 or more insulin injections per day, some states will still not cover that CGM under a Medicaid plan. I have a hyperlink there for providers really to look at a great resource for a guide to state Medicaid coverage for CGM, and we'll make sure that gets provided out to you guys as well. CGM may be covered as a pharmacy benefit, so you might be able to pick it up at your local pharmacy, or depending on your insurance, it also may be covered as a durable medical equipment supply. So if it's denied at the pharmacy, you're likely going to be able to get it sent to your house basically through a mail order third-party company. Pricing really varies. So Dexcom is more expensive out of pocket, if you will, compared to the Libre. Through commercial insurance, though, Dexcom coverage really is going to vary from a minimal cost to a high cost, depending on your copay or your deductible. Medicare patients are going to have the same copay for Dexcom as they would for other CGMs. And for a Medicare patient, if they have a secondary insurance, that secondary insurance is typically going to cover that copay, so they may not have any out-of-pocket cost. In practice, Medicaid would cover fully, but again, whether or not your state is going to cover that may vary. In my opinion, Dexcom self-pay, meaning if your insurance doesn't cover, really Dexcom is cost prohibitive. It may cost $550 to $860 per transmitter. And again, that's every 3 months. And then it could cost an additional $330 for a 1 month supply of sensors. So that's 3 10-day sensors. I don't know of anybody really who would want to just go ahead and shell out, well over about $1,200 or so at the high end on your sensors pretty regularly. So commercial insurance, insurance in general is really going to be the best way to go about getting a Dexcom. Now the Freestyle Libre 2 through insurance, again, most privately insured patients or patients with Medicare or Medicaid will pay anything between $0 and $60 per month for the sensors. Self-pay, if you really wanted to do it, you could get 2 sensors. That's a 1 month supply for only $130. So I absolutely have worked with patients in the past who would spend the $130, maybe wear a sensor for 2 weeks now, work on a couple of things, wait a couple of weeks or a couple of months, wear that second sensor, simply because the amount of information they're going to get from the sensor was still beneficial, and it helps spread that cost out. Both companies do also have patient assistance programs. So this is where we're going to wrap up today. Dexcom and Libre are going to require application and supporting documentation. Biggest things to note for Dexcom: you must live in the United States. In order to qualify for their patient assistance program, though, you do have to have type 1 diabetes. You can have no insurance, or you can't be enrolled in Medicare or Medicaid. So limitation there being, do you have insurance? If you do, you may not qualify. There is an age limit. You have to be 2 years, or an age minimum, I should say. You have to be 2 years or older, and your household income has to be below 400% of the federal poverty line. Libre has a free sensor trial program. So it's not really a patient assistance program long-term, but you could start out on your free trial. Type 1 or type 2 diabetes, must be 18 years or older. But again, you're not eligible if you have Medicare, Medicaid, or another state or federal healthcare program. And then interestingly, if you live in Massachusetts, Puerto Rico, or other US territories, again, you're also not eligible for this free trial program. So there are options out there where you could get some maybe experience with the sensor if your insurance didn't cover, potentially. But unfortunately, there are some hoops you have to jump through or requirements you have to meet. So that completes the preparation material that I have for you guys. As I mentioned, please reach out to Accessible Pharmacy with any questions that you've come up through today's presentation. As I talked with Alex previously, I'm more than willing to share the resources that I put into today's presentation. I really, through this, like I said, learned a lot, and I'm really motivated to do what we can to get CGM approved for individuals with a visual impairment. That alone, I think, should qualify somebody to use a CGM. So I know my team and I are really kind of passionate about this now because we believe in it so much. So again, I want to thank everyone so much for coming out today. I'm going to go ahead and stop sharing my screen, but I really appreciate turnout, and I'm really hopeful that this has helped you guys.
Abby never fails to amaze me with just her knowledge and her experience in this space. I'm just so thankful to be able to work with her and to be able to learn from her all the time. She is absolutely amazing. If you have any questions at all, please don't hesitate to reach out to us. If you are interested in becoming a patient of ours here at Accessible Pharmacy Services for the Blind, we would absolutely love to hear from you. Please don't hesitate to reach out. Our phone number is 888-633-7007. That's 888-633-7007. That's whether or not you have a question about any of the continuous glucose monitoring systems that Abby mentioned, a pharmacy question overall, if you'd like to become a patient, anything at all, give us a call. We would love to speak with you. About the Blind Health Expo in general, we would absolutely love to hear your feedback. Thank you for attending. Thank you for exhibiting if you're an exhibitor. And just thank you for allowing us to put on an event like this in general. We are so grateful for the opportunity, and we are so grateful to be part of this community with all of you. With that said, we will be sending out an email next week, with just some more information on the Blind Health Expo afterwards, information on next year's Blind Health Expo, and then how to, give us feedback on this year's Blind Health Expo. So please, please give us some feedback. And once again, thank you for attending and being a part of it.